My name is Dr. Kyle Richmond. I own Rebuilt Strength and Rehab. See it over here. In New Lenox, Illinois. I've been in practice for 4 years now, 2 years of owning my own space. So that's been eye-opening experience, learning a lot, business owner, clinician, working with a lot of pro athletes now, but I see from professional athletes, the highest level, all the way down to grade school athletes, to everyday plumbers, workers, desk workers is a huge population, and that's why I think most of us are in this live today. We're talking about neck pain, back pain. I mean, as far as hip pain, shoulder pain, you get a lot of pain from sitting in a chair. Chairs are great, but they weren't made with a thought of efficiency for our human bodies. And then on top of that, we put cell phones in our hands. We're here, iPads, whatever. Even when we're writing, I think a lot of people demonize the smartphones, but realistically, when I'm writing, if I'm at my desk, where's my head at? I'm down here. No one's up like this writing. Why I hit on that is a lot of people suffer neck pain from this head forward posture. So what I'll show you, so we're gonna go through a quick general reason for neck and back pain we're sitting, and then I'm gonna answer a bunch of questions I have. But when we're in our chair, if I'm slouched down, where's my head? My head usually tends to be forward. If I'm sitting all the way up with good posture, where's my head tend to go? It tends to kind of be forward, right? We're never really sitting like this. Now, our spine, or our neck in general, has 6 major ranges of motion. Flexion, extension, it's 1, 2, rotation, 3, 4, 5, 6, lateral bend. Also can call protraction, retraction. I should probably say 8 then, to be honest. So 8 ranges of motion. The 2 most important are flexion and extension. So that's down and up. Now ask yourself, where do you spend more time with your neck? Do you spend more time with your neck down, or do you spend more time with your neck up and back? And the answer for 99% of people, unless you're like a painter, you're painting ceilings all day, or bird watching, it's head down, head forward. So what we have to do is work on is resetting that range of motion and opening up the opposite range of motion. And I'll go into this because we had a good question, like asking for a simple kind of thing to do at work. Low back and mid back play the exact same role. We tend to be more forwards. We hardly go into extension. If I'm sitting in my work chair, where's my low back, right? I'm in flexion. I'm in this rounded forward position. We try to sit up really straight, but what happens after about 5 minutes? We slowly tend to slouch, maybe cross the leg up. We sit in this rounded kind of, I hate to say it's a bad posture, but it's only a bad posture if you spend way too long in it. Which also goes to another point that I don't like to say there's one bad posture. It's just whatever you spend too much time in is not great. We can use the finger example. Keeping my finger bent backwards for 2 minutes isn't a big deal. If I held this for an hour, it's going to hurt. Same thing like every other joint in the body. If I push my chin forward too much, if I keep my head down too much for a long period of time, over time becomes stiff and painful, okay? So all this to say that we have to make sure we're constantly moving our bodies, and this goes back to even like the last live that we did. Movement is always going to be king when it comes to this. So let's go through some questions. I'm gonna give you guys some easy stretches and movements that we can do when we're sitting in our office chair or at our desk or even on the couch, to be honest. So let's go through the list here. So number 1, the side of my leg hurts from my knee to my hip. It's abnormally hard. I have plantar fasciitis. I think it's contributed to my leg and knee pain. What can I do? Now it's funny we start right with this one. This one really has nothing to do with sitting in a desk. This is a completely separate subject, but what I'll say is if you're having pain in the side of your leg, most likely your IT band, I would look at your ability to rotate through your hip. If you're seated all the time, you're probably in a lot of hip flexion. You lose your ability to internally rotate. So hip internal rotation would be huge. I don't think that's related to your plantar fascia. I need to probably know more about what you have going on. You also commented, the Vibit eases my pain for a few hours and the pain comes back. How do I keep the pain away permanently? It sounds like it's not a tissue tension issue, it's a strength issue. So I would look at getting your foot stronger, getting your knee stronger, getting your hip stronger. Some sort of strength program would be massive for you. Next question, hey Dr. Kyle, any super quick neck stretches I can do at my desk? My neck's like a rock, back-to-back zooms, lol. Yeah, that's our new norm now post-COVID is all these Zoom calls we're on and just time at our desk. So let's revisit what I was talking about earlier. You're on your Zoom call. Where's your head most likely at? We're here more. So what we're going to do is work on that backwards position. Put up so you can see me. What we're all going to do is take hands on our chin. We're going to push our chin straight back so the back of our neck gets a big stretch, and then we're going to relax. Repeat that for 10 reps. So hands on chin, pull that chin back, go back. From the front, looks like you're just giving yourself a double chin, but what you're doing is you're stretching the muscles on the back of your neck, and your traps are able to actually relax. And we're head forward here. Our traps are firing like crazy, and so is the muscles in the back of our head. So nice relaxed posture in our chair, sitting back, hands on chin, go straight back, and relax. Do about 10 of them and see what you feel. You might get a little soreness back here, but you're gonna notice over time it's gonna help relax the neck and offset our head forward position. So a couple more reps here. Let's go hands on chin. And you can even go into extension if you wanna progress it. So it look like retract and relax. Retract and relax. Now I will tell you, if you get dizzy easily, be careful about the extension. A lot of my patients, I start with just a few weeks of getting better at straight retraction before we go to extension. Now let's quickly touch on why retraction first is super important. If you sit in your normal position with your head forward and you go to extend or look up, what happens? Not a lot of range of motion there. Now if I go to retraction first and then go to look up, tons more range of motion. So I see a lot of people get in this like shrug position, they go here like, wow, that's not helping, it's pinching, it doesn't feel good. Relax your shoulders, chin back, head all the way back. A lot of us instead tend to do the classic neck stretch of this. We're stretching this, we're stretching this, we're stretching this, when realistically we need to send the head in the opposite direction and stretch everything in the front to relax everything in the back. That was a very long-winded answer for that one, but I hope that one makes sense. And then once you clear range of motion in the spine, I go into cars and isometrics and stuff of that nature. But at first, you got to gain full range of motion before we do anything else. Next question, my monitor seems a bit high. Should the top edge be at eye level or slightly below to cut upper back strain? To me, it doesn't matter where your monitor is as long as it's not like down on the ground or way up on the ceiling. There's no perfect, like it has to be here. It all depends on where you're at, realistically, in your chair. Can also play a huge factor in this upper back. You know, if you're in your chair and you're like this all day, that's gonna affect your upper back. Your monitor has nothing to do with that. It's more so of where you're at in your desk. So if we do have that kind of chair that has this mid-back support, take hands on the upper back and extend through and come back down. It's the same idea as the neck, except now we're moving our mid-back. And I tell people you can slide down the chair, you can move up in the chair, but find that sticky point. Arms behind your neck, shoot the elbows to the ceiling, and come on off. That would be my go-to solution instead of saying, hey, I gotta move my monitor up and down. I do see people that have the desks that rise and lower, but half the time we end up putting it too high. Now we're sitting in this weird neck position. Sometimes we drop it too low. Find what feels good to you, but don't stay in that one position for all too long. You gotta constantly try to move in and out of positions. Chair height, still confusing. Got a simple rule so my lower back doesn't scream all day. Again, there's no perfect on this. If your chair is way too low, if you're sitting on the ground, the lower your chair is, the more it's going to bring your knees up, which is going to round your back. So I brought along one of my favorite hacks for someone who sits all day is a lumbar roll. Let's go over why this is so important. So if you remember I talked about earlier that we spend too much time in a rounded position. This is where most people sit. We hang out here. We try to get super upright, and then after like, I don't know, 5-10 minutes, we slowly start to round, and then we're here, we cross the leg, we put our feet up. You take a lumbar roll, you get your butt all the way back in the chair, you sit all the way back into it, and now you're supported. Now I can sit back in my chair, and if you see, my belly is almost pushing forward, which is keeping me in that extended position, which is the opposite where we mostly spend our time, is this rounded flex position. Now when you do get a lumbar roll, the wrong thing to do is bring your butt all the way to the front, sit like this. oh, I have a lumbar roll, but it's not doing anything. A lot of people do that. They put the lumbar roll support in, or they pump it up on their chair, but they still sit like this. You still have to try to sit up in some decent posture. This goes behind you, and now we're sitting into it. My feet are nice and relaxed. To the question about how high the chair should be, if your chair is too low and I'm sitting like this, it's a lot of stress on my low back. Even if I put this behind here, this is going to cause me to round my back the whole time. Stools are actually better the higher your chair is. Your hips are a little lower, which will put you in that more extended position. So, to summarize that one, long answer short, the chair height doesn't necessarily matter. It's about how you're using the chair. You know, obviously I don't want you on the ground. I don't want you 15 feet up in the air, but all chairs are going to be almost identical in terms of small variations. It all depends on what you do with your back, and how well you move and how often you move will influence absolutely everything. If I swap the mouse to my left hand every hour, does that actually ease shoulder tension or just move the pain? I don't necessarily know what pain we're talking about. If it's upper back pain or neck pain, I would be moving our spine more than just switching the mouse, unless you are like leaning on your mouse the whole time. The mouse shouldn't have much influence on your pain. It's going to look at your posture. You know, if I'm still rounded forward but I switch my hand didn't matter. It's more so where I move in my spine. Let's go to the next one here. Okay, I'm a hairstylist. I'm on my feet all day, leaning over clients, one mid-back stretch to keep me loose between appointments. So if you just saw the mid-back stretch I did with the chair, this is great. However, you're a hairstylist. We don't have the ability to go over and back. So I'm going to show you one for the low back that also can hit the upper back. So we're going to stand up. We're going to go hands on our low back. Feet are going to be spread. And we are going to push our low back forward as we lean back. We're going to come on up. And you should feel everything in this low part of your back. You may even get a little higher up if you move your hands up. But we stretch, go backwards, come back up. That is offsetting. And I'm exaggerating. Let's get you higher. When I'm cutting hair, right? We're here all day. You're not standing up like this. You may try to, but what happens? We're here. People are lower down, washing at the sink, whatever it might be. You have to get extension in your spine by hands on low back and pushing, stretch, 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 stretch. Come on off. I'm pushing my hands forward as I go backwards. So this is an easy stretch, you know, not just hairstylists, but all my desk workers. You should absolutely be utilizing that throughout your day. Lumbar roll is great, but this is only going to help mitigate sitting. We still have to get moving. Back to everything I've ever said, movement is always going to be king here. It's funny, I treat a lot of hairstylists and it's always the same thing. It's neck, it's upper back, and it's low back, all going to extension because everything here, electricians, plumbers, hairstylists, desk workers, life is here. Life does not exist in extension for 99% of us. A cheap lumbar support recommendation, roll up towel or pillow works. What works better for an 8-hour shift? So I think these are like 20 bucks. You can get them on Amazon. I've used this brand. I've used the McKenzie brand. This one's really firm. I suggest starting with a softer one, then working your way up. But like 20 bucks, this is way better than a towel because a towel will just get behind you and you still sit in that rounded position. So some sort of lumbar roll, I think off Amazon, like I said, 20 bucks, it'll last you years. I actually have most of my patients take one with on day one if they have low back pain. They put one in their car, they put one at their desk. They even use it on the couch because think on the couch we're in this rounded position, feet up, back is under stress the whole time. Help offset, lumbar roll is my big recommendation there. Last question, any quick resistance band moves I can bust out right by the desk for those stubborn shoulder blade knots? Okay, 99% of shoulder blade knots are coming from your neck and upper back, lack of extension. So go back to that neck movement I taught you, of chin, all the way here, and most people will describe it as, hey, I get this like weird thing here. You're gonna feel it when you do this. That's an aggravated nerve. It's usually referral pain from further up the spine. Start moving to retraction and extension. That'll help offset that kind of irritated nerve that you're feeling down in that shoulder blade. There's really no banded stretch for that because you'd have to really find out, one, where the pain's coming from, and that's also very important to go over. This is just my general recommendation. This is a majority of what I see, I always recommend people go and get assessed. This will work for most people, won't work for everyone, but that kind of knotty shoulder blade thing we get is a lack of, we sit with chin protraction, we're rounded in our shoulders, and the stretch we keep trying to do is like this. We keep trying to stretch and stretch and stretch. Go the opposite way and get your spine moving better, and watch all those referral pains just completely disappear over time. They don't always go away immediately. They do take time. So when we're talking about how often to do all these exercises, because I went over neck, mid back, low back, I would recommend doing them throughout your day, every couple hours. Like I tell people, water's great for you. If you only drink it the first hour of your day, it negates the entire purpose of drinking water. Like, we only have it once, it doesn't matter. You have to have it throughout your day. Same thing with movement. A lot of people go, I tried to stretch. I tried this movement. I did 5 reps once a day. It's not enough to change anything. Like, if you take Advil, how often do you take Advil, ibuprofen? It's got to be every few hours to help increase the dose and spread the dose apart. You can't just take it all at once and hope it just fixes everything. Same way I treat movement, same way I treat everything else. Okay, that was our list of questions. I hope I answered all these for everybody. We talked about chair, we talked about things you can do at your desk for your neck, the hairstylist, the lumbar roll support. When it comes to chairs, I know a lot of people have questions on that. I like a chair with a hard back, or like a solid back, not one that like leans and bounces, because if you have a gaming chair that leans back, you can't use a lumbar roll very well. It's very difficult unless you can lock it and stay straight up. Avoid really putting your feet up all day. A lot of people like to do that, which stresses the low back more. Again, using stuff like a Vibit is going to really help reduce our pain temporarily, and then we can follow up with lifestyle modifications, maybe some manual therapy. Everything's always a multifaceted approach. A lot of people are always looking for that quick, boom, one thing to fix it. Sometimes it works. Most times you need a few different things combined. Most times you need to give it time. Don't just give it 2 days, give it a few weeks. A good rule of thumb is 50% around the time that you've had it. If you've had it for 8 months, give it give it at least 4 months, which sounds like a long time, but most people who had pain for a year, give it like a week. You've had it for a long period of time. If you only had the pain for a couple weeks, give it a week or 2 to go away with the right movements or treatments. Well, I hope that was helpful for everybody. I've gone through all questions, didn't really get any more in the chat, so I will end up ending this here. You're watching the live back. I hope you got something from this. They're very big topics: neck pain, back pain, shoulder pain. It's always so multifaceted. There's so many reasons and causes. I went over my most common for desk workers or people who are in that flex forward position. I know we'll send out another one for next week. Next Friday, I'll be back at noon with a whole nother, topic and list of questions that I'd love to answer for you guys. So I know we send out an email with a Google Doc. You can kind of put some questions in. So feel free to add some in for next week. We try to keep them on topic as much as possible. If there's some ones from maybe before that I didn't get to answer and you didn't get to see answered, please feel free to add that in too. But thank you guys, and I look forward to seeing you next week.